Welcome back again. Now we are going to go through the steps of the cardiac cycle one by one just to make sure you understand what is happening. Okay, so remember, we're going to have alternating contraction and relaxation between the atria and the ventricles, and that's going to require the SA node to send its impulses across the two atria, followed by the atrioventricular node to send its impulse down the bundle of His and into the right and left bundle branches and across the Purkinje fibers. So what we're going to do when we talk about the cardiac cycle is one whole heartbeat. So we start with everything being relaxed, with all four chambers in diastole. Atrial diastole and ventricular diastole. So that's what you're seeing in this picture here. The other things you should note are the pulmonary and aortic valves are closed when all four chambers are in diastole, but the tricuspid and mitral valves are open. So what that means is the blood pouring into the right atrium from the superior and inferior vena cava, as well as from the cardiac veins, is going to pour directly through the tricuspid valve into the right ventricle, and the blood returning to the left atrium from the pulmonary veins is going to be dumped into the left ventricle. So when all the chambers are in diastole in that resting period after the lub dub, that's when ventricular filling is going to occur. So now we're ready to start the lub of the lub dub. And the first part of the phase is atrial systole. So when we have atrial systole, the ventricles are still in diastole, the tricuspid and mitral valves are still open, and the pulmonary and aortic valves are still closed. The only thing that is changing is the right and left atria are contracting, and that's because of the impulse being spread from the sinoatrial node. So whatever blood was still in the atria has now passed through the tricuspid and mitral valve, so all the blood is now in the ventricles. This is going to be followed by a phase known as isovolumetric contraction. What this means is, just looking at the term, is going to be contraction without a change in volume. Okay, so once again, the pulmonary and aortic valves are still closed. Remember, the previous phase was when the atria contracted. They were in systole. Now they're back in diastole. And what is going to be contracting now are the ventricles. If you recall, I told you before, because the impulse starts at the AV node and travels down the septum to the apex and then goes up the outer part of the ventricles, the contraction is going to start down here at the apex and push the blood in an upward direction. So what happens is, when the blood is pushed upward, we're going to have an increase in pressure in our ventricles, and all the blood is going to stay in the ventricles. But what it's going to do is cause the tricuspid and the mitral valves to close. Okay. So this is giving us ventricular contraction, ventricular systole, without a change in the volume in the ventricles. That's the first part of ventricular systole. Now, we are going to be continuing to contract the ventricles, but as we do that, the atria are going to continue to be in diastole. Now the tricuspid and the mitral valves are going to be closed, but we're going to continue even more pressure from below. And what's going to happen is, there's not going to be any more room from that blood. So that blood is now going to be pushing up, and it is going to be opening the pulmonary and aortic valves. So blood will be leaving the ventricles. So this phase is called the ventricular ejection phase. Now, at the same time blood is leaving the ventricles, don't forget that blood is going into the right atrium from the superior inferior vena cava, and blood is entering the left atrium from the pulmonary veins. So blood is also collecting in the two atria. So we have blood entering the upper chambers and blood leaving the lower chambers of the heart during ventricular ejection, during ventricular systole. Now, once the ventricles are done contracting, they are going to relax. The atria are still relaxing. Notice the atria get a long time to have systole. Okay, so they are still relaxing. Blood is still pouring in the right atrium from the vena cava. Blood is still pouring in the left atria from the pulmonary veins. The tricuspid and mitral valves are still closed. Once the ventricles no longer have pressure and they have relaxed, what has happened is gravity has taken over. So any blood that was in the pulmonary trunk or the ascending aorta is now falling down with gravity, and they catch the semilunar cusps of the pulmonary valve and the aortic valve, and that actually closes those two valves. And so this phase is called isovolumetric relaxation because blood does not go back into the ventricles. When the blood comes back down, it shuts the valves. Okay. Then what is going to happen is the pressure here in the ventricles is low. But what has happened to the pressure in the atria? Well, the atria have filled up with blood, right? So that pressure is high. Okay. So the pressure in the atria is going to open the tricuspid and mitral valves. So even though now we have the pulmonary and aortic valves closed, we are opening the tricuspid and mitral valves, and so blood is going to rush into the ventricles from the atria. And any new blood that's going into the right atrium from the vena cava or into the left atrium from the pulmonary veins is going to go directly into the ventricle. So we are going to have ventricular filling. And have you noticed that we are back exactly at our starting point? So that is one cardiac cycle. So if you were to look at this through a GIF, which is not actually showing all the little steps that I showed, but it's just kind of showing it as a cycle. And I'll just let this play like 2 or 3 times so that you can kind of see here's ventricular ejection, ventricular filling, and now atrial systole, send extra blood, and now isovolumetric contraction, and then ejection. Okay, so anyway, you get an idea of what is going on. So before you leave, please look at these pictures. You've got, okay, when the arrows are going out, that's showing filling. When the arrows are going inward, that is showing contraction. So please try to talk yourself through the process and use all the words. Notice in the words that I gave you, I had some things in bold. Those are the really important parts of that particular step, but make sure you understand what the isovolumetric contraction versus isovolumetric relaxation, what that means is going on. And I will see you shortly with our very last video where I just talk about some diseases related to the cardiovascular system, so a lighter topic. But thank you for all your hard work.